Hi, I am Dr. Jessica Larson with Music City Pet Internal Medicine based out of Franklin, Tennessee. I wanted to take just a few minutes to explain what an internal medicine specialist is and why another veterinarian might call on someone like me for assistance. So I went to vet school just like all family veterinarians, and in fact, I started my journey at a Caribbean school and then transferred to an out-of-state school, which was the University of Tennessee. So even though I am a resident of Tennessee now, I wasn't at that time. And that resulted in 5 years of educational loan debt rather than 4. However, I chose internal medicine because I had a great experience as a student at UT, and I had great instructors, and I really enjoyed the complexity of diseases that we'll see on internal medicine and the communication with the pet owners. And many times we can make these pets much better, or we can resolve the disease entirely. And so that to me was very rewarding. And I did need to go on and consider how I was going to pay back my loans. And so in general, specialization does allow a little bit more flexibility there. So a family veterinarian, of course, sees puppies and kittens from when they're young all the way up to end of life in many cases, and handling everything from vaccines when they're very young to spay and neuter surgery, certainly all kinds of various illnesses in between and minor surgeries. In veterinary medicine, just like in human medicine, there are a number of different specialties. And so what that allows for is someone like me to go on and just become more proficient in certain aspects. So there are veterinary cardiologists, veterinary oncologists or cancer doctors, veterinary dermatologists, many different kinds of veterinary surgeons that do very advanced surgery and really amazing things. And so internal medicine is generally a broader category, and so we will handle all kinds of things from liver disease, intestinal disease, urinary system and kidney disease, certain kinds of respiratory disease, occasionally certain types of skin disease, things that are called immune-mediated disease, which is when the body's own immune system goes haywire and causes certain sorts of diseases in the body. And so a family veterinarian would likely call on someone like me when there's a very complex case and the family veterinarian and the pet owner decide that, yes, hey, let's bring somebody else in and get another opinion. And then at that point, we have access to additional diagnostics, which usually include abdominal ultrasound, endoscopy, and I'll talk more about both of those here soon. Certain other procedures, feeding tube placements, taking samples from the bone marrow, all kinds of other procedures that an internist can do, in addition to keeping pets in the hospital when they're very sick. And all of that is wrapped up in communication with the pet owner and the veterinarian. So if you think about it, I actually have 2 people to interface with and to make happy, which is the family veterinarian and the pet owner. And I enjoy that. So there's lots of reasons why I enjoy internal medicine. In my new venture here, Music City Pet Internal Medicine, my goal is to bring a hybrid consultation to the family veterinarian and the pet owner, and then an in-person opportunity to do additional advanced procedures on cases that we've met about and decided that, yes, this is a good next step. So the workflow would look like this. Myself and the family veterinarian are having a conversation. I actually would like to bring the pet owner into that conversation so that we do have an opportunity to all hear the same things and learn from each other, and then make a plan to move forward together, where then the pet owner and the pet would meet me at another clinic in the area, and then we will move forward with doing the advanced testing that we have discussed and decided on, which includes abdominal ultrasound and endoscopy. So this is very different from a more traditional or more conventional referral to internal medicine, but my goal is to move these cases forward more quickly where the family veterinarian and the pet owner and I have all had a conversation and understand the next steps and our options, and then we can meet and move forward much more quickly and try and keep that pet and pet parent happier and more comfortable for longer.